Hey y'all, my name is Morgan Massa, and today we're going to be positioning our patient, Miss Smith, in the different positions. First, I'm going to check my daughter's orders to see what kind of position she needs to be laid in, or when the last time her position change was changed. So, I'm going to knock on my patient's door. Hey Miss Smith, my name is Morgan. I'm going to be your student nurse today. Introduce myself. We're going hand hygiene.
Alright, and we're going to
Put clothes on. I'm going to check my patient's name, date of birth, make sure they match up. Can you say your name, date of birth? Matches the wristband, and it does. This is Miss Smith. I'm going to explain to her what we're going to be doing today. So, Miss Smith, we're going to be changing your position today to try and keep some bed sores from forming. Is that okay? She states that is okay. How are you feeling this morning? She states she's good. I'm gonna raise the bed to a good, comfortable working height for me. That way I don't put a strain on my back when I go to move her. If my patient is not able to help me or is a heavier weight that I'm not able to obtain on my own, I would ask for help and ask a colleague to help me move my patient. So Miss Smith, I'm going to remove your covers so we can move you today. I'm going to hand fold. I'm going to lower this bed rail. Miss Smith, we are going to roll you laterally to your left side. Is that okay? She states yes. I'm going to ask her to cross her feet and to cross her hands on her chest just like this. So first I'm going to explain. We're going to pull you straight to me. And then on the count of 3, I'm going to roll you over. Miss Smith is able to help me, so on the count of 3, I'm going to ask her to help me turn. 1, 2, 3. And she grabs the railing and is able to help. So this is your lateral. Sorry, Miss Smith. In your lateral position, we don't have enough pillows at the moment. So for right now, we're going to imitate this as a pillow. You're going to put a pillow between her knees. And we're going to pretend that this is a pillow. And you're going to put a pillow between her hands. This keeps from pressure forming on the skin and causing any bed sores. So that is that. So I'm going to remove these pillows. And now I'm going to tell Miss Smith that now put her back in position. And now we're going to put her in prone position. This is also supine position on her back. So when it comes to going prone, I'm going to ask her to cross her arms again. Cross her feet. I'm going to move her as close as I can to me with my sheet. And then I'm going to come over here after I put the bed rail up. Most patients, when they go to a prone position, are unconscious. So 1, 2, 3. This time I'm going to make sure your patient's face is good. Your patient's hands are comfortable down by their side. At this time, you're going to place a pillow under their feet, and sometimes if needed you would put it under the knees as well. So, that is prone, and since we're already in prone, I'm going to go to the Sims position, which is I'm going to have my patient lift her left leg up to the side just like this. Miss Smith, we're going to go into prone's position, or Sims position. Is that okay? She states yes. So just like that, I'm going to have my pillow. I'm going to place it under my patient's knee to try and give her a little bit of support. And then, depending on the patient, some do, some don't, you would put it under their arm as well to give them support.
I have a total of 5, 3 mine, 2 of my sisters.
So at this time now, we are going to have her roll back over to supine. So Miss Smith, we're gonna roll you back over. Is that okay? She states yes, and that is okay. So.
Hi, my name is Olivia. Today I'm going to be showing you how to position.
I'm gonna get her to try and move towards me because she's able to help me. So she moves towards me as far this way as she can. I'm gonna ask her to place her arms up under her chest as well. Miss Smith, we're gonna roll you over, okay? She should be. And then if you have a bigger patient, using a half-sheet roll sheet would be better because it covers more area.
I'm going to fold that down. Mr. Jones, I'm going to have to remove this pillow from behind your head, okay?
You want to make sure to remove any wrinkles or anything that can cause pressure. 1, 2, 3. And now I'm going to place her back in a comfortable position. And now I'm going to go over the other few positions. Feet up in the air. Right.
Okay, we're going to start placing some pillows behind you. We're going to get this
Hold on.
place this pillow in between your legs. Help with the pressure. Alrighty. We're going to place it on under your arm. Okay. Is that okay right there? We're going to place some behind your back also.
Grab another bigger dry towel.
Roll some feet.
Raising the head of the bed helps for keeping patients from being able to be aspirated. So this right here would be Fowler's position, and if you go higher, it would be semi-Fowler's position. Or if you go lower, it'd be semi-Fowler's. So Fowler's position would be about a 90-degree angle. This will help patient eat, be able to swallow if they're having trouble eating. So, and then down to about a 30-degree, 30 to 35, or 45 to 90 would also be a would be semi-Fowler's, that one. And then putting the foot of the bed up where the feet are above the head would be called Trendelenburg position. This helps move patients up in the bed if needed. It's a very good position to put a patient in. So when I'm done, I'm going to lower my patient's bed. Nothing's working now. Oh, here we go. Lower my patient's bed to the lowest level. I'm gonna ask Miss Smith if she needs anything. Miss Smith, is there anything else I can do for you today? She just takes note that she is good, she is comfortable. I'm gonna lower the bed, make sure all side rails are up. I'm going to make sure her call light is within reach. And then when I'm done, I'm going to take my gloves off, perform hand hygiene, and then I'm going to go document what I did and what position I put her in.